Brought to you by GTA, your island, your network.
A response effort is underway after it was discovered that a Guam Memorial Hospital employee was diagnosed with active tuberculosis. The employee worked at the GMH nursery and had no signs or symptoms of the disease. It was discovered during an executive checkup. According to hospital CEO Peter John Camacho, the hospital became aware of the situation on August 16th. Since then, Camacho has been working with the Department of Public Health to coordinate a response plan, which Director James Gillen says involves reaching out to all mothers and infants who may have been exposed since April of this year.
The regimen usually requires that all of the children are going to have to be screened, okay, and the mom is going to have to be screened. Any other potential contacts at that time. So the hospital had to spend some time going back over this employee's work schedule just to identify all of the possible points of contact.
The individual worked in the nursery department, and based on the time frame that we're looking at, there are about 328 infants that were potentially exposed to this index case.
In addition, if any positive results are discovered, follow-up screenings will be conducted and mothers or infants will be treated at GMH.
The pediatric treatment for any positive indicator is going to be a liquid form of isoniazid, which is INH. Okay, in our stockpile we have a limited source. Thank goodness through the hospital pharmacy we can use the tab form. Okay, reduce it to get it into a suspension that will be compounded by the pharmacy. So we'll be able to provide the dosages that we need to treat the children.
While infants and children are more susceptible to TB, Gillen said they are less contagious than adults. For families worried about possible exposure, Public Health will be setting up a call line.
We haven't set up a call line yet, but we just want people to know, be aware that we're aware of the situation. You know, we're going to get to each mom, each family member, and the child to make sure that we screen them all.
Meanwhile, GMH physician Dr. Tom Shea noted that many infants actually bypass the nursery altogether.
We've instituted the bypass, I think, several months already. So when the baby's born, he stays with the mom or it goes directly bypass to the OB ward. So there is a setup that bypasses the nursery. So it doesn't really go into the nurseries anymore.
Brought to you by GTA, your island, your network.